Hey guys, it's your girl T, and you guessed it, we're here for another episode of Who's Tea TV. Tonight, we have a special edition. Yes, newsflash, special edition. We are going to be talking about warning signs. Signs that your health may not be where it needs to be. And before we can sip anyone else's tea, we need to worry about our own. You get that? Worry about your own. Oftentimes, we ignore warning signs that something is going on with our bodies, our mind, our spirit, just things of that nature that may be taking place, and we don't see the signs. We're going to talk about those signs. So tonight's flavor is warning signs, with that big triangle with the exclamation mark in the middle. What warning signs do you see, feel, smell, or anything of that nature? You know, your senses are heightened when something's wrong with your body. But what do you do when you have these signs or symptoms that occur? What do you do? That's the question for tonight for me. What do you do in the case that you sense that something is wrong with your... I am not a physician. I am not a nurse. Just someone who is totally aware of things happening in different communities where people have this fear and this anxiety of going to get themselves checked at a physician's There are so many stigmas out there when it comes to going to the doctor or going to the hospital or going to a facility, a clinic, to get your overall health checked out. So the first thing is that you may be fearful, you may be anxious, but it's a necessity. Your health is important not only to yourself, but your families and friends, and also to me. Hence why we're having the discussion this evening. So next we're going to get into prevention. Now, when you think of prevention, you think of preventing accidents or other things prior to them happening. You can do the same for your body. You can prevent your body from shutting down, so to speak. When you see, feel, or hear your body telling you and giving you those warning signs. So one thing that I suggest that everyone does over the age of at least 21 and up, we're going to be talking about tonight, 21 and up, you know, your body will tell you, hey, something's wrong. If you don't have a warning sign, it's not that it's uncommon. However, your body sometimes shows you little things, gives you little nudges, points you in a certain direction, and we ignore it. So tonight we're going to talk about the prevention so we will not ignore our warning signs. When's the last time you've had a yearly physical? For those in the back? No one thinks of that when they're young. You feel healthy, you feel energetic, you're running around a track, or you're going for a jog or going for a walk, but you have these warning signs. Okay, you want your heartbeat to be elevated, get that cardio in, but when do you know that something else is going on? Just think back to these warning signs. Okay, you're going out, you're going for a jog, your heart rate's up. That's natural because you're out for the jog. But what do you think the other signs or symptoms that may occur are going to be? Are you going to get that headache in there? Or are you going to feel overwhelmed, flushed, tired, fatigued, and get dizzy or lightheaded? You have to be out there. I don't want to say be out there, but you have to listen to yourself. When's enough enough? Oftentimes people push themselves to the max and don't realize they're pushing themselves so hard that, they just pass out because they're tired. So you want to go for your yearly physical. to get checked. Most insurances do pay for once a year screening for that physical, for you to be looked over by a doctor, get a blood pressure reading, even some blood work done. It's free for that once a year screening. Now, a mammogram. Recently, they changed the time frame of how often you need to get a mammogram. But if you're over the age of 40 with no family history, they may push it back to 50 now. I'm not sure. You definitely want to speak with your physician about that. Did you know that oftentimes hypertension has no warning signs? Yes, you can have a hypertensive episode and not have any warning signs at all. But if you do have any warning signs, here's what to look for: headache, shortness of breath, fatigue, depression, increased heart rate. Those are just a few. Be sure to look out for those warning signs. You can be having a hypertensive episode. Now, let's get into this deep dive about what warning signs you need to know when it comes to your body. Do you know that excessive urination, lightheadedness, dizziness, weight loss, fatigue, mood swings, and blurred vision can be a sign of diabetes? The gynae visits should be once a year after the age of 21, but if you are under the age of 21 and having some issues, make an appointment. If you're over 21 and you're going once a year, I applaud you, because a lot of people are not practicing self-health love, as I call it. Love yourself enough to go get these prevention screenings. Right time to see your OB or your gynae in reference to a menstrual cycle not being just a menstrual cycle. Okay, I know some people get swelling, bloating, cramping, excessive bleeding. However, if your cycle is lasting for longer periods of time, you can have some type of menstrual disorder. If you're experiencing headache or increased pain and cramping, along with depression, you really want to see your specialist and reference your specialist, meaning your OB or your gynae, in reference to this prolonged, excruciating period. If this episode goes well tonight with you, the viewers, then we're going to do another special episode in reference to uterine fibroids and this excessive pain that I have found that numerous people go through, and how a lot of people, and I won't say people, a lot of physicians or a lot of facilities have not taken seriously when these young ladies go in who normally seem healthy, but they have a multitude of other issues going on. I don't know if there's people that know how to treat these issues, or if the issues are somehow, I hate to say biased, sometimes there's unbiased that a lot of people don't realize they have when it comes to young people coming in with problems associated with pain. So we will get into that topic at a later time, depending upon how the views again go for this video. I'm still trying to find my way, so to speak. So I appreciate you guys tuning in, watching, which brings me to, if you have not subscribed to the channel, please do so now. Hit that subscribe button right below and hit the notification bell right beside it, so that you get all the updates that we have planned for you over here at Who's Tea TV. So now that that's out the way, again, I am not a doctor. I am not a nurse. I just care about you. Did you know that tiredness, constipation, dry skin, yes, dry skin, weight gain, and mood changes can be associated with thyroid disease? Now, a prostate exam that might be every 2 years, depending upon if there's any family history that someone in your family may have. Oh, back to the mammogram. It used to be every year. Now they've said every 2 years, unless you have a pre-existing condition or family history. Let's see. Also, just curious, how often are you getting your eyes and your teeth checked? Did you know you should get your teeth cleaned by a dental professional at least every 6 months? That's something I think most of us were taught in kindergarten, but just in case you weren't aware, this is a nice, fun fact. Have you experienced sudden hair loss? Have you worn a hairstyle and noticed your hair fall is a lot more than usual? It could be a sign of alopecia. I have it. I would know. I've wore a multitude of hairstyles over my many years that have caused excessive thinning, but I also went to the doctor and found out that it was hereditary. So, do you know if you have alopecia, or are you speculating, as I found most people do? They actually don't go to the doctor to get checked because they feel like they are the doctor and know the issue. But hair loss can be caused by many things, such as it being hereditary. It could be your hormones. It could be a very stressful event, or it can even be the type of hairstyles, as I mentioned previously, that we place in our hair and think that nothing's going to happen, excessive dyeing or bleaching, as you may say. So you may want to get that checked out by a dermatologist or a certified skin professional. Don't just assume you know what's wrong, because it could be hair loss due to a vitamin deficiency, or you may have another issue that's underlying that's causing the hair fall. So you definitely want to get that checked. Warning signs of depression. Also, there was a question of, how do you know a doctor fits right with you? You're not just going to know it by seeing someone and meeting them from the first time, and you guys organically have this chemistry together where you feel like, yeah, he's the one. Sometimes that may happen, but a majority of the time, for most of us, it does not. So a couple things that I suggest. I suggest that you, know what you need. Know what you need prior to your appointment. Have a list of any medications that you're on. Have a list of any issues you're having. Because if you're like me, as soon as I see the coat, the white coat, yes, I freeze up and I forget everything that I needed to speak with the doctor about. So that's one of my suggestions. Excuse me for a second. Excuse me, thank you. I'm sorry. I have a condition that causes my mouth to be dry like all the time. So again, that's a warning sign. Know your body. You know something's off, go get that checkup. Sometimes it may cost you, but aren't you worth it? I'm just saying, make sure you realize you're worth more than that $30 copay. Okay? Now, let's get into not only knowing the doctor is the right fit for you, but also we want to understand that we have Google now. We have different resources that weren't available back in the day. So you can go online and check to see if your insurance company gave you a doctor's name to go to. You can, Google that name, click that in, and then look at the reviews. I guarantee you that each doctor that has a medical license currently across these United States has some sort of review on the treatment of care that they've performed on everyone. I know we all may have a auntie or an uncle or grandma or grandpa that's been to a doctor and it's going way wrong. It's going way left. But medicine has changed since then, meaning how doctors practice. The technologies evolved. You know, the cell phones we use today has evolved from the first, the flip phone. So medicine changed too. Technology change. You know that if you ever going to get an x-ray, those machines are updated more often than we realize. If you do not have insurance, you can check with your health department, your local health department. And there are different organizations that work with the health department that offer free treatment, preventative treatment for people that are not insured. There's a phone number that you can find online of 888 Ask HRSA. I am not being paid to give you this information. I'm giving you this information to promote a healthy you. No one is going to take care of you like you. I know we all have family and friends that may love and adore us, but again, you are your main priority. Guys, I know this was a lot of information to drop in one video. However, you are, again, important to me. So why would I not want to share all the things that I know with you, my subscribers, my viewers, my family and friends that may be out there that are not aware that there are different organizations out there to take care of you because they care. There is an organization called National Association of Free and Charitable Clinics. They provide access to care for all uninsured people. That means if you have a cousin, auntie, friend, cousin twice removed, ex, boyfriend, girlfriend, whomever that does not have access to health insurance, you can look up that National Association of Free and Charitable Clinics, find their phone number, and they will put you in touch with the right people so that you can get the treatment you need. Do not let the warning signs of your body go unnoticed or undetermined or unchecked. You have to be the voice for yourself to get yourself out there and be looked at. If you go somewhere and they are unable to help you and you still have an issue, go get a second opinion. You are worth every penny of that investment in your body. Until next time, toodles.